Your body already makes its own painkiller. It's called anandamide. And scientists just found that one common oil, rubbed on your skin at night, stops your body from destroying it. That means your own natural pain relief stays active longer. And most people have no idea that certain oils can travel deep into your tissues and change things at the cellular level. We're talking about real, measurable reductions in chronic pain, inflammation markers in your blood, and visible changes in how your skin ages. Scientists have been studying this for decades, and the results are honestly shocking. These aren't trends or wellness fads. These are compounds that interact with your immune system, your nerve receptors, and your skin's own repair mechanisms. By the end of this video, you will know exactly which oils to use, how to use them, and when. And the number one oil on this list. Researchers found something in it that actually mimics a drug your body already makes. And it works better than most over-the-counter creams. You need to hear this one. Number 3. Rosehip seed oil. Rosehip seed oil comes from the seeds of the Rosehip plant, a wild rose native to Europe, Africa, and parts of Asia. It has been used medicinally for centuries. Records show Chilean women have used it topically for skin healing since at least the early 20th century. But it's only in the last few decades that science caught up and started explaining why it actually works. The key is what's inside it. Rosehip seed oil is extraordinarily rich in trans-retinoic acid, which is a naturally occurring form of vitamin A. This is a big deal. Retinoic acid is the active ingredient in many prescription anti-aging treatments. When applied topically, it signals your skin cells to increase collagen production, speed up cell turnover, and reduce the enzymes that break down the skin's structural proteins. Your skin starts repairing itself faster. A randomized, double-blind trial published in the Journal of Cosmetics, Dermatological Sciences and Applications in 2015 tested rosehip seed oil on participants with visible aging signs over 8 weeks. The results were clear. Participants using the oil saw a 45% improvement in skin moisture, a 43% reduction in the appearance of fine lines, and a 23% improvement in skin brightness compared to the placebo group. These are meaningful numbers, not marginal differences. But here's what makes rosehip seed oil more than just an anti-aging cosmetic. It contains both omega-3 and omega-6 fatty acids, specifically linoleic acid and alpha-linolenic acid, at a ratio that your skin barrier actively uses for repair. When your skin is inflamed, cracked, or damaged, these fatty acids help rebuild the lipid barrier that keeps moisture in and irritants out. A study published in Skin Pharmacology and Physiology demonstrated that topical application of linoleic acid-rich oils significantly reduced inflammation markers and accelerated wound closure in compromised skin compared to oils high in oleic acid. Rosehip oil also contains lycopene and beta-carotene, both of which are antioxidants that fight the free radical damage caused by UV exposure and environmental pollution. Free radicals are unstable molecules that attack your skin's collagen fibers and DNA. Antioxidants neutralize them before they can cause lasting damage. Now, how do you use it to get maximum benefit? First, always choose cold-pressed, unrefined rosehip seed oil. The refining process strips out the retinoic acid and many of the antioxidants, and you end up with something far less effective. Second, apply it at night. Rosehip oil is slightly photosensitive because of its vitamin A content, so daytime use increases the risk of irritation when exposed to sunlight. At night, your skin is also in active repair mode. Cortisol drops, growth hormone rises, and cell regeneration accelerates. You are working with your body's natural rhythm. Take 2 to 4 drops. Warm them between your palms and gently press the oil into your face, neck, or wherever you're targeting. Don't rub aggressively. Pressing allows the oil to absorb without dragging delicate skin. Within 3 to 4 weeks of nightly use, most people begin to notice visible changes. Within 8 weeks, the research shows you should be seeing measurable improvement. One thing to be aware of: rosehip seed oil does go rancid relatively quickly because of its high polyunsaturated fat content. Store it in the refrigerator after opening and use it within 6 months. If it smells off, like old cooking oil, it's degraded and the beneficial compounds have broken down. Fresh oil has a light, slightly earthy scent. There's also something worth mentioning about who benefits most from rosehip seed oil. Research shows it's particularly effective for people dealing with scarring, hyperpigmentation, and uneven skin tone in addition to aging. A study published in the Tohoku Journal of Experimental Medicine followed patients using rosehip oil on surgical scars over 12 weeks. The rosehip group saw a 56% greater reduction in scar coloration and texture compared to the control group. The mechanism appears to be rosehip's ability to regulate melanin production through its vitamin A content. Melanin is the pigment responsible for dark spots and uneven tone. By normalizing the signaling that triggers melanin overproduction, the oil helps existing dark spots fade while preventing new ones from forming. So if you're someone dealing with sunspots, post-acne marks, or surgical scars alongside general skin aging, rosehip seed oil is doing multiple jobs for you at the same time. That's what makes it genuinely useful and not just another trendy skincare ingredient. Now let's move up to number 2. And this one has some of the most impressive pain and inflammation data of any topical we're going to discuss. If this is already surprising you, subscribe and hit the bell. Number 2. Frankincense essential oil, Boswellia. Frankincense oil is extracted from the resin of the Boswellia sacra tree, which grows in the arid regions of Oman, Yemen, and Somalia. Humans have been harvesting this resin for over 5,000 years. Ancient Egyptian texts describe it being used to treat wounds and inflammatory conditions. Medieval physicians used it for arthritis. And now modern molecular biology is telling us they were onto something real. The active compounds in frankincense are called boswellic acids, specifically AKBA, which stands for acetyl-11-keto-beta-boswellic acid. This molecule does something very specific. It inhibits an enzyme called 5-lipoxygenase, or 5-LOX. That enzyme is directly responsible for producing leukotrienes, a family of inflammatory molecules that drive pain, swelling, and tissue degradation in conditions like arthritis, tendinitis, and inflammatory skin disorders. By blocking 5-LOX, frankincense cuts off one of the main chemical pathways your body uses to create and sustain inflammation. This is not a mild effect. A clinical trial published in Phytomedicine in 2008 tested a topical Boswellia extract cream on patients with knee osteoarthritis over 12 weeks. Compared to the placebo group, the frankincense group showed a 50% reduction in pain scores, a 43% improvement in physical function, and measurable decreases in the inflammatory biomarker NNP3, which is a protein that actively destroys cartilage tissue. The researchers noted that improvement began within 7 days for most participants, much faster than typical anti-inflammatory medications. Another study published in the European Journal of Medical Research found that oral and topical Boswellia extracts reduced leukotriene B4 production, one of the key inflammatory chemicals, by up to 65% in patients with active inflammation. That is a dramatic suppression of one of the body's most powerful inflammatory pathways. For your skin specifically, frankincense oil has been shown to promote fibroblast activity. Fibroblasts are the cells in your skin's dermis responsible for producing collagen and elastin, the proteins that keep skin firm, smooth, and resilient. As you age, fibroblast activity slows down. Frankincense appears to stimulate them back into action. Research published in the Journal of Traditional and Complementary Medicine found that frankincense extract significantly increased collagen synthesis in fibroblast cell cultures. Your skin doesn't just look younger, it's actually producing more of its own structural proteins. Here's how to use frankincense oil correctly. This is an essential oil, which means it is highly concentrated and should never be applied directly to skin without dilution. The correct dilution is 2 to 3 drops of frankincense essential oil per teaspoon of a carrier oil. The best carriers for this purpose are jojoba oil, which closely mimics your skin's natural sebum, or sweet almond oil, which absorbs quickly and doesn't leave a heavy residue. Once diluted, you can massage the blend directly into painful joints, inflamed muscles, or areas of skin you want to improve. Use firm, circular pressure over joints. This increases local circulation and helps the compounds penetrate deeper into the tissue. For arthritis or joint pain specifically, apply it twice daily, once in the morning before activity and once before bed. Studies showing the most significant pain relief used consistent twice daily application over at least 4 to 12 weeks. You need to be patient with this one. Boswellic acids accumulate in the tissue over time. The effect builds. People who stop after 2 weeks because they don't notice much are quitting before the real results kick in. The 12-week data in the arthritis studies is where the most dramatic differences were recorded. One important note: frankincense essential oil quality varies enormously by supplier. Look for oil that specifies the Boswellia sacra or Boswellia serrata species and shows a gas chromatography purity test. Adulterated or diluted oils will have almost none of the active boswellic acids and won't produce the effects the research shows. This is one case where buying the cheapest option on the shelf genuinely does not work. It's also worth knowing that frankincense oil has shown promising results for people dealing with inflammatory skin conditions like psoriasis and eczema. A study in the journal Skin Pharmacology and Physiology found that Boswellia extract significantly reduced the skin's immune overreaction that drives these conditions, specifically reducing the IL-17 and IL-23 signaling pathway, which is the same pathway targeted by several expensive biologic medications prescribed for psoriasis. That doesn't mean frankincense replaces medical treatment, but for mild to moderate flares, or as a complement to existing care, the anti-inflammatory mechanism is real and backed by data. Applying the diluted oil to affected patches twice daily, keeping the area moisturized, and giving it at least 6 to 8 weeks is what the research protocols looked like in the studies that showed the most benefit. All right, let's get to number 1. This is the one researchers compared to a molecule your own brain makes, and the results stopped scientists in their tracks. Number 1. Black seed oil, Nigella sativa. Black seed oil comes from the seeds of Nigella sativa, a flowering plant native to Southwest Asia and the Mediterranean. The oil has been used medicinally for over 2,000 years. It was found in the tomb of Tutankhamun, the Egyptian pharaoh who died around 1323 BCE, which tells you how long humans have valued this plant. Islamic medical texts from the 11th century describe it as a remedy for nearly every condition except death. That sounds like hyperbole until you read the modern research and realize how many systems in the body this compound actually affects. The molecule that makes black seed oil extraordinary is called Thymoquinone, or TQ. This compound has been the subject of over 1,000 published scientific studies in the last 30 years. And what researchers keep finding is that Thymoquinone operates through multiple biological pathways simultaneously, which is rare for a single natural compound. Here's what Thymoquinone does when it reaches your skin and underlying tissues. First, it directly inhibits NF-kappa B, which is the master inflammatory switch in your cells. NF-kappa B is the transcription factor that activates dozens of inflammatory genes at once. When NF-kappa B is active, your body produces a cascade of inflammatory chemicals, including IL-6, TNF-alpha, and COX-2 enzymes, the same enzymes that ibuprofen targets. Thymoquinone suppresses NF-kappa B, which means it's hitting inflammation at the source before those downstream chemicals are even made. A randomized controlled trial published in the American Journal of Otolaryngology in 2011 found that topical application of black seed oil reduced nasal inflammation symptoms by 63% compared to the placebo group, with measurable reductions in IgE levels, a key immune marker associated with inflammatory responses. Another study in phytotherapy research measured the effect of Thymoquinone on inflammatory arthritis markers and found a 49% reduction in TNF-alpha and a 52% reduction in IL-1 beta, two of the most destructive inflammatory cytokines in the body, after 8 weeks of consistent use. Now here's the part that stops scientists. Thymoquinone was found to interact with the endocannabinoid system. Specifically, it appears to inhibit the enzyme FAH, fatty acid amide hydrolase, which is the enzyme responsible for breaking down anandamide. Anandamide is your body's own natural pain-relieving molecule. It's sometimes called the bliss molecule because it produces sensations of calm and pain relief. When FAH breaks anandamide down too quickly, pain signals persist. By inhibiting FAH, Thymoquinone essentially keeps your own natural pain reliever in circulation longer. A study published in the British Journal of Pharmacology demonstrated this FAH inhibiting mechanism and described it as comparable in effect to several synthetic analgesic compounds in animal models. For skin aging specifically, black seed oil has shown remarkable results. A study published in the Journal of Dermatology and Dermatologic Surgery in 2016 had participants apply black seed oil to half their face, using the other half as a control, for 60 days. By the end, the treated side showed a 48% improvement in skin moisture content, a 32% reduction in wrinkle depth as measured by optical profilometry. That's a precise optical measurement technique used in dermatology research, and significantly reduced redness and skin reactivity compared to the control side. The researchers attributed this partly to Thymoquinone's antioxidant capacity, which tests show is more potent than vitamin E in neutralizing certain free radicals. Black seed oil is also one of the few topical oils with documented antimicrobial properties. It has been shown to inhibit Staphylococcus aureus and several other bacteria that commonly contribute to skin infections and inflammatory skin conditions like acne and eczema. A study in the African Journal of Microbiology Research found that black seed oil demonstrated significant inhibition of multiple bacterial strains, with minimum inhibitory concentrations comparable to some standard antibiotics. So how do you use black seed oil to get everything research says it can do? You have two options, and ideally you do both. Topically, apply cold-pressed black seed oil directly to skin. It does not require a carrier oil because it is gentler than essential oils. Though some people prefer to blend it with jojoba for a lighter texture, use a small amount, about half a teaspoon for the face and neck, and massage it in with upward motions before bed. Pay particular attention to areas with chronic pain, inflamed joints, or aging skin. For joint pain, apply and then cover the area with a warm cloth for 10 to 15 minutes. The warmth increases local blood flow and drives the compounds deeper into the tissue. The quality issue matters enormously here too. Look specifically for cold-pressed, first-pressed black seed oil from Nigella sativa, not Nigella damascena or other species, sometimes passed off as black seed. The Thymoquinone content varies significantly between products. Some studies have specifically used oils with Thymoquinone concentrations standardized to at least 0.5% to 1.5%. Unrefined oils from reputable suppliers typically fall within this range. If the bottle doesn't mention species, pressing method, or Thymoquinone content, it may not be potent enough to produce the results shown in clinical research. Consistency is everything with black seed oil. The most impressive results in the published literature, the 48% moisture improvement, the 52% drop in inflammatory cytokines, came from studies where participants used the oil daily for 8 to 12 weeks without interruption. This is not a one-night fix. It is a compound that builds in your tissue and produces results proportional to how consistently you use it. Give it 60 days of nightly application before you evaluate whether it's working for you. The science says it will. And when you combine it with frankincense and rosehip into a nightly routine, you are covering three completely different biological mechanisms: collagen production, inflammatory pathway suppression, and endocannabinoid-mediated pain relief, all at once, without a prescription. These three oils, rosehip seed for aging and skin repair, frankincense for pain and inflammation, and black seed oil for everything from pain pathways to immune modulation, represent three of the most research-backed topical compounds available without a prescription. Use them consistently, buy them cold-pressed and pure, and give them time. Your skin, your joints, and your pain receptors will tell you the difference. The science is there. Now it's just about being consistent enough to let it work. Now we want to hear from you. Which of these three oils are you most surprised by? And are you already using any of them? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.